Hello, and welcome back to the Jefferson Enterprise Preoperative Education Series for Bariatric Surgery. This presentation is the fifth in the series and will detail what you can expect after your surgery is complete. This video is specifically about beginning your Stage 1 postoperative bariatric diet. The day of your surgery, you will remain NPO, which means that you cannot eat or drink anything leading up to your surgery. You will also be NPO for a few hours after surgery as you are continuing to recover. If after a few hours you are recovering well without significant nausea or vomiting, you may be able to start the Stage 1 bariatric diet, also known as the clear liquid stage. If not, you will start Stage 1 the next morning. Stage 1 typically lasts until 2 days after surgery. Please follow your dietitian's instructions exactly with regard to advancing your diet at home. When you are given the okay to start Stage 1, your nurse will provide you with a menu and a stack of medicine cups. If for some reason you do not receive these items, please ask someone to get them for you. Your nurse may also be able to provide you with water, Pedialyte popsicles, Gatorade, or other similar items before you order because they often have these items stocked on the floor. Just ask. As a way to help you take small sips while also measuring how much you drink, you will be using medicine cups. This medicine cup equals 1 ounce, or 30 milliliters. Sip this slowly and frequently, with the goal being to finish it in 15 to 20 minutes. Finishing 1 medicine cup, or 1 ounce, every 15 to 20 minutes means you will drink 3 to 4 ounces per hour, which is 3 to 4 medicine cups. You should be able to drink at minimum 3 to 4 ounces comfortably and consistently, and be able to drink fluids for 4 hours without significant nausea or vomiting while in the hospital. Doing so means that you will be able to drink enough fluid per hour to stay hydrated when you go home. Besides the importance of only consuming clear liquids while in Stage 1 of your diet, there are a few other things you should remember. Number 1, no straws. The air intake that happens when you use a straw can cause fullness, which can result in discomfort. Number 2, no carbonation. The bubbles from carbonated fluids can cause pain. Additionally, they can contribute to pouch expansion over time. And number 3, no caffeine. Caffeine can cause dehydration. You can discuss with your outpatient team about when it would be safe to have caffeine again after surgery. As you progress through the stages of the bariatric diet, you may be able to begin cautiously using straws and consuming caffeine. You should talk to your dietitian about this if you have any questions. Sometimes there are things that can cause a patient to have difficulty drinking enough fluids right after surgery. This includes pain and nausea that is not well controlled. As discussed in the previous videos, your team will work to get your pain and nausea under control so that you are able to drink appropriately. It is very important that you focus on drinking fluids, even when it feels like a challenge. Just keep sipping. Your discharge could be delayed if you are unable to drink adequately, so it is very important that you begin sipping fluids as soon as you are told you are allowed to begin. If you are able to tolerate fluids for 4 hours without significant nausea or vomiting and drink up to 3 to 4 ounces per hour, you will be able to be discharged the morning after surgery to continue your recovery at home. Remember that you play a very important role in your recovery, and you should be prepared to sip very frequently in order to meet your hourly and daily fluid intake goals. It will feel like a lot of work in the beginning, but over time it will get easier. While you are still on Stage 1 of your diet at home, you will continue to follow the same diet and guidelines that you did at the hospital. At home, you should aim for 4 to 6 ounces of fluid per hour to meet your 64 ounces per day fluid goal. I'll repeat that because it's very important to remember. At home, you should aim for 4 to 6 ounces of fluid per hour to meet your 64 ounces per day fluid goal. If you drink 4 to 6 ounces per hour, you will be able to drink 64 ounces in the amount of time that a person is usually awake during the day. This means you will also be able to sleep well at night and not have to get up to drink. Please reference the nutrition guidebook given to you by your dietitians, as well as the information that you are given at the hospital if you are unsure of something. And if you can't find the answer you are looking for, please call the office and someone will be able to help you. Once you are at home, if you are experiencing nausea unrelieved by anti-nausea medication or nausea with vomiting after stage 1, please call your surgeon's office and they will help you troubleshoot. Thank you for watching. Please be sure to continue on with the next videos in the preoperative education series, which continue on with what you can expect in the postoperative phase. The next video is about preventing postoperative complications. Thank you.